So, welcome. I don't have an intro. That's like, par for the course for me. So, we're just going to dig right in. Tell me about how you got involved into chiropractic.
I had the opportunity to manage an office when I was in undergraduate school. Chiropractic was zero on my radar, and we had to do an internship. And I happened to get connected with an office that took care of a lot of families, a lot of pregnant moms and kids, which really, for me at the time, challenged my idea of what I thought chiropractic was and why people would go see one. But the gift of that was that with managing the office, I talked to a lot of them and I saw women change. And I heard about how you could birth different. And that was really interesting to me. And they gave me a book to read. It was small when I started. And the way that it talked about our body and how smart it is when it has the opportunity to express itself without having anything interfering. That made a ton of sense. And from there, I knew that I wanted to go into a career. I was studying kinesiology, thought maybe I'd go into the diet side, but also felt like that might not be for me. And it clicked. Everything about being in that office clicked and made me want to pursue the kind of work that they were doing as well.
So, since you've started specializing in, would you say pregnancy, postpartum is your specialty as a chiropractor?
Yep, I would say so. Okay. Yeah, that perinatal period, right? The time before you get pregnant, through the pregnancy, and afterward. The kids too, and the dads. But right now in this phase, the moms have a really special place in my heart because of the phase of life that I'm in. That might shift as I get further into having kids that are growing and not necessarily adding to our family. So we'll see. But right now it's the pregnant ones and postpartum.
Yeah. Okay. So as a postpartum mom yourself and experiencing all the things that you've experienced postpartum, how has your chiropractic expertise sort of fueled or opened your eyes to some of the things that postpartum moms experience? And what's been your experience with that?
On a personal level, I think what I didn't understand at the time when I got out of school is that I had learned about something that was going to help me heal a decade later when I was in the midst of my own perinatal, mood and anxiety stuff and learning about myself and why I reacted and did things the way that I did them, especially after having children. That made that all a lot more acute. And what I've grown to understand for myself and the women that I talk to, because we talk, that I'll share things vulnerably about my experience, and I hear me too from most of the women that I talk with. So I know it's a shared experience. It's not glamorous, so I don't know that it gets the attention that it deserves. And I don't know that we're necessarily told the story of our agency and our autonomy and how we can learn about our body and our nervous system and trust how smart it is. And that if we can take the time to get to know why our body might be perceiving a threat when there isn't an active threat present, that we can adapt within ourselves versus needing our environment to adapt so that we can be showing up differently in our families, which I think changes the entire tone of our family unit and system, which is really beneficial, I think, with the amount of external noise that we have now. So how has it changed? I went from being really intellectually solid in the foundation of knowledge that I had and the additional education that I had taken in how do we need to think about pregnant women and postpartum women and women that are preparing to conceive uniquely. Because I do think that those women deserve a really special kind of care and a special lens of care, just like children with special needs do, just like athletes do. These women are a unique population, and so why not have them see people and providers that are going to look at them with that kind of reverence and respect that they deserve. And so it went from having the intellectual understanding and knowledge to now that I went through my own dark night of the soul, experiencing it myself, even having all of the knowledge, it didn't immediately translate into the application that I'm really grateful to have had the gift of learning, and now I get to apply for myself and other people.
how would you say nervous system changes after childbirth impact people's nervous systems as a whole?
Sense of safety. Safety is the first word that comes to mind. I think I have been humbled in the last decade of growing to understand that there's not one right way to birth. And a lot of the birth experience has to do with how that mom is going to feel supported and safe in her environment of choice and with her provider of choice, with her birth team of choice. And from my own experience and the stories that I hear from the women that I get to take care of, you can have the same quote unquote birth experience, but the woman comes out of it very different. And it can be interpreted as trauma, which it feels like a hard word to say in relation to birth, because there's so much being talked about relative to trauma right now and the different ways that can show up in different experiences. But I think it's worth asking the question that if a woman is going through that birth experience and she comes out feeling not safe and feeling like she experienced an event that was traumatic, and that's going to impact her physiology, which is going to change the way that her brain and her body are communicating, and her body to her brain. She's going to experience threat where maybe there isn't a logical threat. And if she doesn't have the ability to articulate that, or know who it is that she can contact, or have the village of women or people that she feels safe enough to tell them about the thoughts that she's actually having, I see that as something that can be incredibly long-lasting and impact not only her health long-term, also the health of her family. And it can go unnoticed and quiet. And I don't think that's fair. I don't think that's the way it's meant to be. And I hope that that's something that we can shift and continue to shift. I think it's starting and it's happening. I see more people talking about matrescence and that really true maturation that we go through from maiden to mother. And I think that that's where I hope that I'd like to see the conversation about birth shift, and how I think that is going to be something that impacts that mom's nervous system.
Yeah. So when women are postpartum and you see them, what are some of the ways that you help them through chiropractic work through birth trauma, no matter what that birth trauma looks like?
Professional collaboration, knowing the right people what I do is unique, and I looking at the nervous system, understanding where and when to address and adjust the nervous system so that body can interpret more safety in the environment, so it can make better sense of the information that it's receiving, right? Like bad information in, bad information out. So if we can do something within our profession to impact the health or the accuracy of the information that mom is receiving, that's my piece. I can offer tools in my practice, worksheets that the mom can fill out that can tell me, is this mom at risk for a perinatal mood and anxiety disorder? Because depending on the research that you look at, 1 in 5 to 1 in 7 women are going to be impacted by this. And for that, half of those will have their counterparts, their male counterparts or partners that are also going to experience a perinatal mood and anxiety disorder. So not that we necessarily take care of the mental health piece of it, but we can certainly impact the body's perception of safety. And from there, we can know who it is professionally that we can get that person connected to, or maybe a couple professionals, so that they could reach out to them and find which of those is the person that I connect with best. So they could be a person that I can add to my team, my professional village, to support my body and help me make sense of this new woman that has emerged, and how I can care for her and learn about her and bring a new, better, for lack of a better word, version of me into my family unit in that way.
So what have you found are some of those worksheet sort of like risk factors associated with the type of women that might experience postpartum mood disorders?
What we would use in our practice is the EPDS, the Edinburgh Postnatal Depression Scale. That is one of them. That in our practice, we would introduce that to a woman if we're taking care of her in pregnancy during her last trimester, in the weeks of the 30s, toward the end, and then also immediately postpartum, and for certain week intervals postpartum as well. That's one of them. And that will give you a score, which tells you that this woman is not necessarily at risk. Maybe she's at a watch number, and or you need to get her connected to a professional now, because she's at risk for herself and for potentially her baby as well.
And what are some of those questions related to specifically?
Some of them have to do with the intrusive thoughts that you might be thinking, which I imagine, on having been privy to taking that assessment many times myself, having had babies, that is one of the harder ones to answer honestly and transparently, because I think there can be such a stigma attached to us being admitting that the thoughts that we're thinking are alarming. And it's not that they're true, but the thoughts are certainly there, and it can become something shameful and just tough to talk about. And you need a safe place to be able to approach that with the right provider who's going to hear you, validate you, and remind you that you can get connected with people who can help you, and that you're not alone in it. That's really important. It will ask questions about the quality of self-care. You're bathing. Are you eating? Are you drinking? How are you interpreting your overall quality of life? Are you bonding with your baby? That can be such a great indicator for me when I take care of a mom. I just had an opportunity to do a house call with a mom, and all the normal 4 days postpartum, teary, lots of feels that are coming there. But I could also see that she was really beautifully bonded with her baby, and that she was holding her and keeping her close. And it didn't sound my alarm bells that the baby's not close, or the baby is to the side, or maybe the baby's with another person, or the mom is closed off. Like there are normal things we can expect with what is going to happen to a woman's body after she has a baby, and things with her hormones change. They are just things we should expect. And then there are additional, I think there's an art in noticing the things that tell you maybe there's something wrong here. Not wrong, but maybe there's something that needs more attention and better help. And how do we get her connected with the right, safe people that aren't going to make her wrong, but are going to remind her about who she is and how smart her body is, and that she was made for this process, and that it's part of the growing pain of, like, a child becomes an adolescent, the girl becomes a mother, and not all of that is pretty and easy. Yeah.
It's funny because I feel like as moms, new moms, old moms, however, we have this need to show up as perfect, and the way that we do things has to be perfect. And I think it has bred so much conflict inside moms and almost pitted us against one another for, like, you're either like a conventional mom or you're a crunchy mom, and like you can't be friends.
Yeah. How do you identify? It's like the list of questions that we go through when we meet each other of, am I even going to invite you possibly into my circle of a person that I'm going to connect with? Or because we think about this thing differently, I cloth diaper and you use a disposable diaper, that we make that a point of separation instead of getting curious about, why do you do it that way? Or just, great, that works for you. Where else can we connect? It is, and we're bombarded with information, be it social media or elsewise, that touts a completely different story. We are fed to believe that we're going to bounce back into the version of us that existed before we got pregnant with the baby to begin with. And it is biologically wrong. It's just so wrong and so harmful. And, like, what a radical idea to think that we're going to show up as women and, like, learn about each other and support each other and create a village that we can lean on and not judge, but ask better questions.
Mm-hmm. So when it comes to postpartum women that you visit with, you have extraordinary attention to detail to see the little things. we all struggle postpartum. I think that's just universal. There's just like this tiny thing. Maybe it's screaming, maybe it's fine. You know, babies are all different, right? What are the warning signs, though, for her to be watching out for?
That's a really good question. What would that look like? What I would want that mom to look out for? I would feel curious about the level of comfort that she feels, or the level of confidence that she feels about being willing to sit in the feeling or emotion that she's having. If she can get curious about it and then identify the need that's beneath there, and if she feels like she can ask for help meeting that need, or if she doesn't necessarily have the external support to meet that need, is that something that she's able to create within herself to meet that need and therefore reap the benefit of the safety that will give her? I would be some really practical ones. How often are you showering? How often are you eating? When you serve the people in your family, if you're a mom with a partner or with multiple children, are you serving them food and cleaning up while they eat, and then you eat once everything's clean and they're done? Are you including yourself purposefully with your family unit, or are you so hypervigilant and focused on getting the environment clean that has to happen first before your brain can calm down and allow yourself to eat?
Ooh. My kids are so old, and that hits me so hard because I feel like I did that for so long.
I still do it. And I will stop, and my family hears me now say, "What are you doing, Danielle? Sit down." I have to say out loud, "This is okay. I can wait to do this until we're done eating." Or, "Hey guys, this is what's happening in my body. I need help. I might not know exactly what that help is, but do you see a way that we can work together so that I don't feel like I'm doing this by myself?" Yeah, are you eating? I think it's like I hear quotes about like where the wound is deepest, like that's where the light can come in kind of thing. And if this is like a collective wound that we have as women who have birthed, whether it's something we're aware of or we're just not necessarily aware of, what a way that we can band together and change that dynamic, because it's something, like I said, I talk about things like this and I hear me too more often than I hear, "Oh, I never feel that."
Right?
Yeah, I'll think about taking my supplements, but I won't do it. And then I'll think, "What is that? You gave vitamins to your children this morning. You had them do that. You set them out for your husband. And you've thought about it 3 times, but you didn't go over and open the flippin' thing that they're organized into and just take them. Why? What is that? Like what?" And then I'll ask, what is it in me that I'm so unsettled with? Am I angry at myself? Am I really sad about something? Because usually behind that anger is sadness or fear, like something that I haven't processed there. But it's like this really purposeful choice to continue putting other people first and forgetting that if I'm not taking care of myself, they can't actually reap the maximum benefit of me being in that like feminine mother power. There's, the pyramid, like Maslow's hierarchy of needs. Yeah. There is one, my therapist sent it to me. It was life-changing. That's all about maternal mental health. So where is that? I'd be happy to share it with you. It's like, thank you so much. And it helped my husband and I too, because we looked at that and said, "Ooh, no wonder you can't climb your way to the top and tell me how you'd like to be in practice, Danielle. That is 4 steps ahead of you haven't showered in 6 days. You didn't have breakfast this morning. You haven't had water. You haven't taken, anything to support your body supplementation-wise for 14 months. A long time has passed. You think that it's going to be short and tomorrow will be different, and then you hard blank in the midst of having a new child, and a year and a half has gone by."
When with my partner recently laid out like what are my biggest priorities like in my life, and for me my wellness is now like my top priority, and then my family, because
Yes.
when I can care for my wellness first, like my entire life is completely different. So when it comes to women that are postpartum that are unsupported, that maybe don't have a good access to like a network, or don't perceive that they might have access to a good network, what are your recommendations for them?
I think that's deeply personal too. And that's maybe where I struggle with a concrete answer. I think that could be found in finding the right people online, that when you are going to be doom scrolling anyway, you can start doom scrolling with things that are going to hit you with information that makes you feel more connected than disconnected. Or maybe it's less of a highlight reel that you're looking at, but now you're looking at accounts that are really talking positively about matrescence, or showing people like matrescence. There is a company called Peanut, I believe. And if I understand the company correctly, I think it's around to get women linked together. It's like a dating app for moms.
I love that.
Which I think is a really cool concept and idea. Like that could be a way, right? Because I also think that you have to find and be honest with yourself about which avenue is going to create the most safety in you. So as you explore it, you aren't feeling traumatized, so you can actually receive that support that you're looking for. Doing it your way, not the way that you think you're supposed to do it. It could be going to the libraries that host free classes. It could be going to the playground and being willing to start a conversation with one of the people there.
That's scary.
It is scary. And yet I found myself last night at a playground with a mom that was visiting from out of town, and we got into the best, most vulnerable conversation about birth and what it's like to take ownership of reproduction after you've had babies. And like just learning about your body, we left that thinking, well, if I'm ever in Indiana, I'm going to come in and see. I wish I could get reconnected with you, because she started it. I didn't even start that. She said something not superficial. That's maybe not the right word, but pleasantries about the children. And then you see maybe breastfeeding. Can I approach that one? And she says something about breastfeeding. And then it was co-sleeping, and then attachment parenting and weaning and
all
what
those
you do,
buzzwords.
like all of that tell you, okay, I can continue going a little bit deeper. And I think as you learn more about yourself, and you're able to know how to trust your body, that when you're around the right people, that you can trust that your body is going to tell you, yes, it's okay, maybe do a little bit more question digging there. Or you go far enough and then your body tells you, I don't think they're the right person to go there with. And letting that be okay. And not that there's something wrong with you or something wrong with that person, but that my body's telling me for whatever reason right now, it's a no. And maybe that has to do with the conversation you're talking about. Maybe that has to do with where you're at in your cycle after you've gotten it back postpartum, and your cycle just has you in a place that's saying social connection, minimal, please. That's what's safe for you. So maybe it's, in response to your question, maybe it's online, maybe it's in person through, I think most communities have local opportunities for moms to get together that maybe you just don't know about. There was MOPS, which is now MomCo. We have so many groups in our area. The Mom Walk, that's another one. We have people popping up all over Southwest Florida with businesses that are all geared toward that period of time, usually from moms who went through and experienced that. The way that their body interpreted that trauma was, I am never going to let another woman ever feel the way I felt when I was at my lowest. And I certainly feel that. That's what I want to do with all of the really hard stuff that I've had to make sense of since becoming a mom, and then having life and hurricanes and child stuff.
So many things. There's so many things.
Every year we get an opportunity for the entire season, for months of acknowledging that we could be under threat, and what do we do with how our nervous system is activated. And if you aren't even aware of that, then you're just under this chronic mild stress, which is really terrible for you to begin with, without the way out, which is you. Yeah.
I kind of love this conversation. And in my head, I was like, well, we have to talk about like physiological, like postpartum things because like she's a chiropractor and that's what
It's all connected.
she does. But I'm just starting to realize, I think most of the time when I'm talking to someone about women's wellness, that the nervous system and stress and your body and your emotions and all of that stuff comes up more than anything else.
Thank goodness that conversation is shifting, and that it's not just chiropractors who are having a conversation about the nervous system anymore. Like now it with polyvagal theory, looking at that and helping that make sense of where we're at on that kind of ladder, which would be language that you understand if you've looked at the polyvagal theory, but there are breathing, mindfulness. I have so many tools that I've received from my therapist that in moments of activation, here are questions I can ask myself to figure out where am I? And okay, this is where I am. Now this is what I can do to take me from being here to being a little less so. And then when I'm a little less so, I can ask myself a different question. And now I can answer that and learn more about myself and figure out which tools work and where might I need more help. For me, chiropractic is at the top of that. If I don't know for certain that good information is going in and good information is coming out, I have a hard time trusting the quality of the thoughts that I'm thinking. That's usually my first question. When did I last get adjusted? And then I can kind of weed out from there so many different directions. When did I last take a shower? I thought this morning, when did you last take a shower, Danielle?
It's
what's
so
the
real.
quality of the food that I'm eating? And also being mindful of with how much we know, not making it become something that like I pick up my shame stick and I'm beating myself internally when I eat something that old me would have been very not happy with. And could I shift that a little bit? Or if I need to get a meal out for my family instead of cooking it in and it's not my top choice of where I'd go, can that be okay for that time? Can I give myself some grace? I think having now 4 children, I have had to learn to give myself grace that the expectations that I have can be so high that it becomes something that berates me instead of encouraging me to continue doing my best. And I wouldn't ever talk to any other person that way. I don't talk to any of my friends that way. But my inside voice is,
She's so mean.
she's real mean. And earlier this week, I had really observed myself being really just like disappointed, and I could identify that. Like,
And then
wow,
you're mean to your mean voice.
yeah, like you're really upset with me right now. Why? What is that about? Because it's so familiar too. It's comfortable. It's not healthy, but it's comfortable because I've gotten so used to staying there and thinking that that is me without understanding that that is a really unhealthy coping mechanism or response based on the trauma that my body has interpreted uniquely in my own. I had heard of a method called RAIN, RAIN, and I've taught this to my kids too.
What does that stand for?
Recognize, allow, investigate, and nurture. Recognize what you're feeling. Allow it, accept it, investigate it. I love questions, so start asking some questions and then nurture it. So we'll go through that together most times.
And I want to discuss chiropractic care postpartum. And I want to discuss how it helps the nervous system, how it helps the body recover, and what the other benefits of it are.
Common things that we hear moms talk about with their body after having a baby. Think pelvic floor, that hip region can be pretty uncomfortable. Think about moms looking down at their beautiful baby while they're eating, be it breastfeeding or bottle feeding. You're putting yourself into a position that has your head down. And after a while, like you see moms that are doing this like thing because they feel really compressed and like they're going into the fetal position with their tiny baby, watching them. Though like physically, that's really common. And awkward sleeping positions too that moms are going through. And within there too, great professional collaboration option with pelvic floor therapists, because we can really excellently address the area of our nervous system that talks with all of those muscles and those tissues. It was just something that we talked about with the midwife students about the sacral nerves, so the bottom of the spine, those nerves, and how that's the primary nerve channel that's communicating with the muscles of the pelvic floor. And so that's what we get to do. And we can do that in a really gentle and specific way. So where we get a lot of attention as chiropractors on the internet because of how loud we can be and how extraordinary the adjustments can look and where we can stand while we do it. And it's really theatrical and it's dramatic. And I'd be lying if I said a part of me didn't love that, because I do love all different types of things that we do, because it all works. And that's the beauty of what we do. I would argue that the right technique with the right person is going to work. That's the beauty and the art of how we apply it. For women that just had a baby, we're wanting to support the part of their nervous system that stays in that rest and digest. So would it be reasonable to assume that they deserve a different kind of adjustment that's going to encourage that part of the nervous system to stay online and stay present, to help them with bonding, to help them with quality rest when their body's able to rest, to help them with digesting the food that they're going to eat after having had a baby while their hormones are recalibrating and readjusting, which is going to impact all of those areas of their body to begin with. Especially so, like we had talked about, perceiving threat. How can we help them better interpret the information in their environment as something that's safe instead of something that they have to be afraid of?
You and me, I'm 13 years into doing the whole go to a chiropractor thing, and you're a super long time into it as well. But for people that can't make the association between, maybe they don't even know what polyvagal theory is, maybe they can't associate or wrap their heads around, how does getting my body adjusted, like I see on those TikTok videos, how does that translate into my nervous system, my postpartum experience, and my ability to rest? Can you connect those dots?
I can do my best. The way that I think about it is that our body is always taking in information from the environment. We are soaking it in all the time. And then based on how that information travels up to our brain, and then our brain makes sense of that information, that's going to determine the way that we express a response to the environment that we're in or the pain that we're having. And so, like we had talked about, however it is that you choose to impact that nervous system with getting adjusted, it's undeniable. I mean, there are people if you would want to do a deeper dive, Dr. Heidi Havoc has incredible research about exactly what is happening in the brain at the time of adjustment and how you can absolutely quantifiably show that that adjustment has impacted the nervous system and that you are different coming off of the table than you were going on to the table. And so I think there's some art there then for the provider in deciding how does that story fit into their unique gift in this profession. How is it that they then are able to encourage the people that they get the honor of taking care of to say, this is the science, and then you get the choice of telling the story of what this means for you and how it's going to impact your unique quality of life. For some people, it is pain that brings them in to see a chiropractor. Thank goodness, because we're really good at that. For other people, it's wanting to optimize their birth experience because the research would tell you that if you're going to get adjusted while you're pregnant, you're likely to receive a great benefit of having a shorter, easier, more effective labor and recovery experience postpartum, be it a birth if it's a vaginal birth or a belly birth, a cesarean. All of that is positively impacted regardless of the way that you're going to birth if you're under chiropractic care. That's undeniable.
It's funny because your husband was my very first chiropractor, and I met him doing a walkthrough of Baby Love Birth Center, which was the only birth center in our area. And he happened to have an office inside the birth center because he was just opening his practice. And I walked by him and she was like, and this is a chiropractor. And my understanding of chiropractors was just they crack your back. But I had scoliosis. And I was like, logically to me, it makes sense. If my hips are crooked, my baby might get stuck. Maybe I should see this guy, right? So it started with that, and that is how I got into this whole rabbit hole of wellness that literally your husband is responsible for introducing me into. And ironically enough, my baby did get a little stuck, but I was still able to have him vaginally. And even though I didn't see him until 37 weeks, I am absolutely convinced that it gave me a shorter birth in comparison, even though it was still like a pretty rough birth, but it was... I think it could have landed me with a cesarean section or, whatever I would have ended up with, which would have been fine for the record. But I was happy to be able to have that, experience and I attribute a large part of it to the chiropractic care. So,
it sounds like that makes sense. You had a great foundation of trusting that some things just kind of make sense when you think about them. Like think of a building that's built on an uneven foundation. Is that building going to be straight or probably crooked or leaning? Would it be reasonable to expect that all of the soft tissue in our body, in all of our body's glory and how smartly it's designed, is going to compensate, and the muscles are going to compensate to create stability and keep your body safe and your baby safe? Because it's a smart response, not because there's something wrong with you, but because it's adapting to the way that your body has settled. That sounds reasonable. That would be worth investigating.
I love the way that you talk about how people's bodies adjust to their surroundings and how it's perfectly okay for them to do that. Like, that's super cool, by the way.
It's a really smart process. Sometimes we need help making sense of that information and responding in a healthier way.
Yeah.
But it's still very smart. It doesn't mean that your body's doing something wrong. It means it's doing its best with the information that it's had and the foundation that it was given after you were born. That is where we're like, that's where my passion for children in chiropractic comes in, because we have an opportunity to change the way that they perceive life from the start. That we can create that safety in a way that we weren't gifted. And not only because of chiropractic. I think it would be short-sighted to say only because of chiropractic in that way, but I think because of the way that we understand how powerful our nervous system is, and the way that we've grown to understand how our experience of safety during that time is going to impact our ability to cope in our adult world when we grow and we become adults and we have the autonomy to do things our way.
What does your perfect patient base look like? Like, what does a whole day at that practice look like for you?
The whole day, it would be a combo of, like we had talked about, the women that are thinking about getting pregnant, but not quite there yet. Or maybe they've learned so much about how their body works. They say, you know what, I'm going to give myself 3 or 4 months of changing some things. So when the time comes that I'm going to try to conceive, I know that the quality of health of that egg is different than what it would have been like had I tried now. Based on the stress that I've gone through in the last 3 or 4 months, I can give myself some time to make some different choices. That's certainly for me something I wish I could have gone back and done a little bit different for some of my pregnancies. So those people, would love to have them there, because then they soak in the rest of the people, which would be the pregnant moms who are feeling really informed and confident and excited about the way that they are going to birth, the way that they're preparing for it. It'd be the moms that are soon postpartum and their babies, definitely their babies too. Dads as well, or partners as well, absolutely welcome and thrown into the mix. But when I think of, for me right now, where I think I'm uniquely positioned, it's those women. It's that part of our generation that I would want to be with at this time, with the experience that I've had and what I've had an opportunity to learn about the information that I have and how I've been impacted by it, and the resources that I now have for these women with my experience and the shared experience of other women around me. That's who I think I can really help. And then I know other people here locally that when it's not those people, I say not me, but them. they're going to be your person. Or these couple people, look into them and see who's the right fit, because you need this. It's going to help you, but it might not be me.
I love your vision for what you can have and create, because I think I've seen a lot of content and read a lot of things that have said that the experience of birth and the experience of postpartum and women's nervous system in general can literally like transform the world. And I think
Yes.
I'm like getting emotional talking about that.
Yes, it can.
And I just think that is like, I don't know, maybe you're here for that.
I sure hope so. There are thousands of women who are not in a good place. When you like, if the 1 in 5 to 1 in 7 women that in postpartum are going to experience perinatal mood and anxiety disorder,
I feel like it's more than that, for the record.
I imagine it is, right? Because that's just what's reported. That's not the Me Tooers that are not necessarily saying it out loud in other capacities.
How many of us are there?
I looked this morning in Lee County about births. We had, in 2004, Lee Health reported about 8,300 births, 8,302 to be exact. So think of just one calendar year in one healthcare system, over 8,000 births. And if you look at the 1 in 5 to the 1 in 7, that's anywhere from like 1,100 women to 1,600 women in 1 year that have navigated or continue to navigate a mood and anxiety disorder. So something that is so common becomes normalized, and we hear, well, this is normal. You know, it's like the rite of passage that we're sold, just like it's normal for your nipples to bleed and crack when you're breastfeeding. Like the rest of us.
Nipple cream on that.
Yeah, this is normal when your baby's clicking and popping off and really uncomfortable, and it just, power through it like we did. Toughen them up. And and it begs the question, like more people are asking, is common actually normal? And are there better questions that we need to be asking to get these women connected with the right people to take care of that unique woman?
I wonder how much of our hesitance or even our postpartum mood disorders or anxiety or depression might potentially stem from what we've been told from a traditional healthcare perspective and all of the, voices around us, and how has that sort of like conditioned us to once again, just not say anything and then have shame in it.
And then, of course, mixing some like shame into the mix there. That encourages all of us to talk vulnerably to other people about what we're actually experiencing. Think generationally too, even. That was part of what I talked with this mom about at the park last night, was telling her about a study, about the mice study, where they look at the impact of stress over generations of mice that had a stress response to a smell when they had never actually experienced the pain of the shock that caused the stress in their ancestors. And so we were talking last night at the park of what if that's tied into our birth experience, that the way that we birth has to do with the way that the women before us have birthed, and that the way that we think and feel about birth and the way that we do it isn't even ours, and it's us working out this generational gift that we didn't want to receive. So when it comes time to read about orgasmic birth or Ina May Gaskin or birthing without pain and hypnobirthing and hypnobabies, all of these incredible tools that it's like, yes, our logical brain is, yes, I'm going to do it. And then you get to birth, you're like, oh no, there's so much still in there that I didn't even know was in there that's going to keep me from having that experience because I didn't go deep enough to really retrain that part of my mind.
Just parenting our children, reparenting ourselves, and parenting our parents. It's great. What a nice little burden or blessing.
Yeah. I kid with a friend of mine that we're like the Oreo cookie, like the inside, we're like the white cream part, like arguably the best part of the Oreo cookie, but we're going up and we're going down. I certainly feel that. I can see my mom going through her own version of asking herself better questions and connecting that to my grandmother. And then I see my daughter already showing me things that I can see that I really unintentionally have instilled.
Ugh.
that I thought would be different. And then our challenge is not to make ourselves wrong, but to say, look at this information and what do I get to do with it now? And what tools do I need that I don't have?
If I have to be the sandwich generation, at least I'm an Oreo cookie sandwich generation.
Oh yeah, it's so good, right? Like there's a lot of good in an Oreo cookie, but it is dark and it is light.